this is where I think we earn our stripes, so to speak. I mean, this is the greatest privilege that we have as neonatologists, is helping families cope as best we can. Because I'm sorry, it's relatively easy when the babies are following the recipe, and they're getting better, they're weaning off CPAP, they're weaning off their IV, they feed, they go home. I mean, you just sort of keep saying, okay, no change, no change, no change. They're doing what they need to do. But boy, when things are going the opposite way, when the stock market is on one of those downward trends, okay, how do you as a neonatologist help parents? And like I say, this is where we have privilege, and we have an opportunity to do it right. And so I'm going to go back to the control. One of the things that I commonly say, and this is not said in any malicious way, it's just how I try to get parents to cope. What I say to them is, as a parent, your job is to protect your child. And as a parent, your job is to make decisions for your child which are in their best interest. And one of the most distressing things that a parent can experience, and I'm a parent too, as I've disclosed, is that feeling of loss of control. And so going back to my earlier comment, I usually set the stage for that discussion by saying, if you're like many parents, you and your partner have talked throughout pregnancy about, at this point we want this done, at this point we want this done, and then we're going to do this. And you might have already, I've heard of this, I've heard of it, I've never seen it. Parents, even maybe before the birth of a child, trying to register them into their preschool, like they've already, thought about, stuff like that. So you have families with varying degrees of control that they have. And this control has been torn apart. They've lost it. And so what I often will say to families is I'll say, I need you to make some decisions. And no matter what decision you make, none of them are going to feel right. There's no question that you are going to have to make decisions that you never wanted to make. And you're just going to feel like no matter what decision you make, it's not right, because you're not getting what you want. What you wanted is to take your child home, whether it's without a disability or at all. And so what I'll say to them is, you're in a position where you've lost control, and I'm now going to offer you the opportunity to take some of it back. So you're going to make a decision. It's not a decision that you're going to love to make, but you are going to take some control back and do what you think is in the best interest for your child. Sometimes that means withdrawing care. Sometimes that means, putting in a gastrostomy tube when they didn't want to have one done. Sometimes that means having to do a tracheostomy. But what I try to impart to the parents is they are able to do something loving and caring for their child, and in so doing, take back some of that control. And I have found that when I use that with families who are in distress, it often gives them it gives them a feeling of wellness in some way in a terrible situation. And it is fascinating to me. And I don't know I'm sure a psychologist would tell me, what this is all about, but it allows them again to regain some of that control, which I think is very important.